So in today's topic, it's normal development, chapter 46. Those who have the textbook, chapter 46, normal development, page 610. So the first 2 years of life, it's very important for your brain development, child's brain development, as well as physical development. It depends on the mother's breastfeeding as well. Okay. If you're able to prevent malnutrition during the first 2 years, majority of the lifestyle diseases, chronic diseases, okay, threat to life can also be eradicated. Okay. So when we talk about the first 100 days of life, it's soon after the post menstrual day. Okay, the last time the mother had periods, before she got pregnant. Okay, from the time she conceives to the second birthday of the child, that is the first 1,000 days of life. It's very crucial for the brain and growth, development and growth. Okay, because during the first 2 years, the body growth becomes 20% of that of the adult growth. Okay, the brain growth is around 80% of the normal adult brain. Okay, and majority of the myelination is also complete. Myelination is the process in which the central nervous system develops. Okay, the neurons and all, the nerves and all, it develops. So by the 2 years of life, that is the first 100 days. Okay, all these major aspects of your growth will take place. So even through primary healthcare services, nutritional supplements, okay, proper care can be given so that you can get the desired outcome in these days. Then you have the motor development, language development, personal cognition, okay, social development. These are the four main domains of development for children. Okay, when we talk about cognition, motor development is the movement. Okay, each one of that we'll discuss in detail. Language, there are phases of language development. Then cognition is the mental action or the process of how the child understands. Okay, how the child becomes knowledgeable, how the child experiences and achieve senses things around it. Okay, how the child forms a perception. Those things will come under normal development. So when we talk about the reflexes, okay, there are more reflexes to this as well. Some of the major reflexes are here. We call this as neonatal reflexes, which are there present in the newborn babies. As soon as the child is born, these reflexes are there. Slowly, when the child grows up, these reflexes it fades out. Okay. So first is the FPR reflex. From the 5th to 8th week of in the uterus, okay, before birth, this reflex is there. Okay. Fear paralysis reflex, it is like the child becomes stiff. Okay. The child becomes frozen, stiff, no movement at all. That is the FPR reflex. Then you have the Moro reflex. It is like the from it appears at birth, okay, and till 2 to 4 months it will be there in Moro reflex. The child will get startled if there is a light or suddenly if you're making a sound, the child will immediately startle and just wake up to any stimuli. That is Moro reflex. Okay. Then you have routine reflex. Routine reflex, the purpose is it will help the child to find food to go near the breast. Okay. So baby automatically turns their head towards the touch on their cheek. Okay, if you are touching the child's left cheek, the child will turn their head towards the left side. If you are touching the child on the right cheek, the child will turn the head towards their right side. So where which part of the cheek is getting touched, which side of the cheek is getting touched, the child will shift their head towards that area. Okay, it helps the child to find food, go near the breast, because it's usually the mother's breast that touches the child's cheeks. Okay. Then you have the palmar reflex, which is the hand will close when the object is placed in the palm. You must have seen how the newborn babies will hold on tightly to a finger. If you place a finger on the child's palms, it will hold on to that finger tightly. Okay. So it helps the child to develop their grasp. But at birth, it is there. By 5 to 6 months, it will integrate. Okay. The child will, usually the children know how to grasp, but they don't know how to release. That they have to learn. Okay. Palmar reflex will help you to grasp things, but to release things, it will take time. Then you have the ANTR reflex, the tonic neck reflex, asymmetrical tonic neck. So, the child's head will move along with the body. Okay. It is like when you are turning the child's head to the left or the right side, as the head goes to either left or right, okay, the arm and leg on that side will extend, okay, and the opposite limbs will bend, okay. So if the child's head is being moved on the left side, left hand and left leg will extend, it will stretch out, but the right hand and the right leg will bend, okay. It's usually useful for during the birth, okay, to help the baby move through the birth canal. Then symmetrical tonic neck reflex. Arms and legs will bend and extend when the head is bent down. Okay. Arms will straighten and legs will bend when the head is bent backwards. So this kind of a movement will help the child to crawl. Okay. It appears late, like by 6 months and all, it will start appearing. Then TLR reflex, tonic labyrinthine reflex, in which when the head is bent forward, it will cause your body and the limbs to flex. Okay. So it happens during the in uterus point, when the child is within the uterus. Then spinal Gallant reflex, the child's hip will rotate whenever the child's back is touched on the either side of the spine. Okay. Whenever you touch the child's back on any side of the spinal cord, whenever you touch the back, the hip will rotate, the child's hip will rotate towards that area. Again, this helps in the birth for crawling, okay, and creeping. That kind of movement, these reflexes will help. There are other reflexes also mentioned in the textbook. You can just read that. Stepping reflex, placing, sucking. Sucking reflex, when you put a finger in the child's mouth, the child will start to suck on it. Okay, it helps with developing the strength of the sucking reflex during breastfeeding. Parachute reflex, Landau reflex, abductor spread of knee jerk reflex, plantar grasp, that is the fingers, toes, and the toes will also bend when you touch the sole of the feet of the child. Okay, so that is plantar reflex. These are different types of reflexes. Coming to gross motor development. So it helps in movement and also your brain, how it controls the movement. Reflexes have to disappear, and then certain developmental milestones will start to happen. So the first locomotor skills, gross motor development, it is movement, balance, rotation, okay, other manipulation of limbs. Okay, these all come under gross motor development. So crawling, creeping, hopping, running, changing directions, skipping, walking, tiptoeing. Okay, these all are locomotive developments. These come under the child's developmental milestones. Then gross motor balance and rotation skills, jumping in air and for a short distance, walking downstairs, standing on one foot, climbing, trying a tricycle. Okay, by second year and all, by second year, 1.5 year, 2-year-old child, they will start having this balance and rotational skills. They try to balance themselves on one leg, tiptoeing and all. Okay, they play with balance. Then gross motor and manipulative skills, kicking a ball, throwing the ball, okay, throwing the ball underarm overhead, aiming at a target, catching a ball, large ball and all. So it requires much better skills. Okay. That comes under gross motor manipulative skills. So these are the major gross motor development that has to take place. Developmental milestones in a table they have given age wise, at which age what milestone has to be achieved. Then coming to fine motor adaptive development, these are finer movements, okay, not the big movements. Gross motor development is usually your legs, arms, feet, head, hips, and all. Okay, finer movements are more finer things that you can do skillfully. Okay, hand skills and all, coordination, hand-eye coordination, hand-mouth coordination. Okay, these comes under fine motor adaptive development. So hands, it will start grasping objects more precisely. Also, it will start to develop in-hand manipulation of objects, try to change the object, open any object, okay? If you assemble toys, disassemble toys, play with zips and buttons, okay? Hold crayon with all fingers and able to scribble it on the book. Turning doorknobs, okay? Lids, opening the screws, lids on and off. When you give a block or color blocks to the child, okay, the child is able to make a tower out of it. Paint with a brush, okay, or able to put large beads inside a thread. Put a large thread through the beads. Handle scissors. Puzzles, small puzzles, three-piece puzzle and all, okay. Able to feed themselves with spoon and fork. These are the fine skills the child has to develop with hands. With mouth, child is able to chew table food, okay, bites through crunchy food, use a straw, able to blow bubbles, drink from normal cup with minimum spilling. Little bit spilling will be there when child is trying to hold the cup with both their hands. Minimal spilling will be there. And eyes, hand-eye coordination becomes more precise. Okay, the child is able to locate objects with eye. Okay, the child is able to play I spy, hide and seek and all. Child is able to see smaller objects further away. Then feet, the child is able to stand on tiptoes. able to grasp things even with toes. Okay, starts to develop arches of the feet that is not present when the child is born. The arch, you can see the curve that happens. Okay, that will start to develop. The child will feel confident in carrying its own body weight and walking around or trying to stand up and walk around. Language development. Pre-linguistic stage, it's 0 to 6 months. Here, it's non-verbal communication usually. Okay, sets the foundation of language development. Okay, the child cries, coos, okay, causes gestures. Okay, points out things, looks at people. When he or she hears the voice of mother or father, they identify it. Okay, and look towards them. Babbling will take place. Babbling 6 to 12 months, essential for speech development. The child will try to produce uh, similar sounding sounds. Okay, it may not have the same pronunciation, but it will sound somewhere similar. Okay. Then telegraphic stage, 12 to 18 months. Here the toddler will produce their first words, understanding simple introduction, instructions, okay, following one-step commands and all that will take place. One word, if they may have some specific words for food, mum, something like that. Okay, some specific words for milk, water. Single word stage is 18 to 24 months. Expansion of vocabulary will take place using single words. They will start using pronouns and all, like he, she, wo, ye, like that. Okay. Objectives, complex sentence structures will develop here. Then two word stage is 24 to 36 months. They will understand simple instructions, follow one step commands. And multi-stage words is 3 to 5 years. They are more proficient in their language. They can form sentences. They are able to use correct grammar and all. Okay. And they can also engage in communication. More than few sentences of communication they can engage in. So these are the different areas of language development. Then personal, social, and emotional development, groups, friend groups, and all, and even at family. So examples of things that the child can include: the child is able to tell the difference between right and wrong, perhaps what happened, okay, how they feel. They can also identify why somebody is sad or happy, okay. They can understand friendships and families, the communication between friends and family. They play with their friends, form bonds, okay. They work on others' ideas, comments, okay. Like they may share their toys, play with each other's toys, ask questions here. They will know what person to ask what, okay. So their social development is taking place. They will be able to communicate their wants, needs, and opinions, what they want, what they need. Do they want to buy something, where they want to go, what they want to do, okay. They can also engage in small talks around the home, okay, or also helping out at home, like picking up the toys, okay, helping the mother clean, okay, wash vegetables, something like that, which they find playful as well. Understanding their own and others' feelings and emotions, they will also communicate, I feel bad, I feel sad, okay, that this is hurting me, like that they will say. They will ask out for help as well if needed. So these are the personal and social and emotional development. By 6 months, the baby can like drink from a cup on their own. By 15 months, the child can eat on their own with a spoon and also with a cup. By 3 years old, the child has a gender identity. The child identifies gender. They will identify themselves as a different personal. Then you have Piaget's stages of cognitive development. So stage one is sensory motor stage, 0 to 2 years old. Okay. Here reflexes also come under this stage. It's a sensory stage. By 4 months, thumb sucking, repeatedly thumb sucking, finding it pleasurable is seen. Language demands object permanence. These things are developed here. Curiosity about the world, trying to see or taste things or whatever they find new, they will try to eat it, put it into the mouth. Intentional actions may also form here. They like the toys which is making sound. Trial and error method of understanding things will form here. So pre-operational is the stage two. 2 to 7 year old child will have this stage. They will have a symbolic kind of thinking. They will develop their statements, grammar, the way to express, the way to communicate. Okay, they are very imaginative, very intuitive. Okay, very complex and abstract thoughts they will have, very colorful imagination they will have. Okay. They can hold on to a conversation, ask questions, clear their doubts. Then you have the concrete operational stage, 7 to 11 years. So concepts regarding life, people around them, who is a good person, who is trustworthy person, these kind of concepts will they will develop. They will have a favorite family member, favorite friends. Okay, they can understand that concept of time, space, quantity, what time of the day it is. Okay, uh, what is 1 hour? These concepts will develop here. Then we have the formal operational stage, 11 years and older, adolescents as well. So here theoretical critical thinking, hypothetical thinking develops. Okay, abstract logic and reasoning will develop, strategies, planning. Okay, they will learn a concept, they can apply that concept in their life situations. Okay, so that kind of cognitive development will take place in the formal operational settings. Then there's a concept of object permanence. Here, it means a child's ability to know that objects continue to exist even though they cannot be seen or heard. Okay, so even if even if they're closing their eyes, it does not mean the object has disappeared. It is still there. Okay, so whenever you play peekaboo with the child, okay, that's when the child understands what object permanence is. Okay, usually when the child thinks when they're closing their eyes, everything has gone. Okay, things don't exist. But when they open their eyes and they see the thing is like that only in front of them, so they understand the concept of object permanence. Nothing is going anywhere, even if they shut their eyes, or if they're not seeing it, does not mean it does not exist. Okay, that is object permanence. So that's about normal development, some basic concepts of